L-carnitine is a compound produced by the body from lysine and methionine. It can be acetylated to produce acetyl L-carnitine, which is similar but crosses the blood-brain barrier more effectively. L-carnitine is best known for its involvement in the mitochondrial oxidation of long-chain fatty acids. It's found in food and is most prevalent in meat, and beef in particular. It seems to have a high utility in liver disease, where it reduces ammonia levels, the symptoms of hepatic encephalopathy, and various markers of poor liver function. An improvement in sperm quality has been found with supplementation of high doses. Improvements in male fertility have been noted in a small number of studies. It seems to help women with polycystic ovary syndrome by reducing some of the symptoms. And one study found an increase in fertility, but more research here is needed. Acetyl L-carnitine and possibly L-carnitine 2 show efficacy in depression, though more research would be needed to determine how useful it is. It seems to reduce fatigue in older adults with low muscular endurance, but its effects on athletes during physical activity aren't particularly consistent, though research supports a small improvement. L-carnitine may slightly limit muscle damage during resistance exercise. It seems to have minor beneficial effects on blood pressure, blood glucose, insulin sensitivity, lipid profile, oxidative stress, and inflammation. Overall, it seems useful in metabolic syndrome, but not a first choice. When it comes to fat burning, studies in isolation do not show very good results. Some studies have found minor fat loss, which is typically attributed to increased physical activity due to the increased energy levels. L-carnitine is a nutrient and a dietary supplement. It plays a crucial role in the production of energy by transporting fatty acids into your cell's mitochondria. The mitochondria act as engines within your cells, burning these fats to create usable energy. Your body can produce L-carnitine out of the amino acids lysine and methionine. For your body to produce it in sufficient amounts, you also need plenty of vitamin C. In addition to the L-carnitine produced in your body, you can also obtain small amounts by eating animal products like meat or fish. Vegans or people with certain genetic issues may be unable to produce or obtain enough. This makes L-carnitine a conditionally essential nutrient. L-carnitine is the standard biologically active form of carnitine, which is found in your body, foods, and most supplements. Acetyl L-carnitine, often called ALCAR, is possibly the most effective form for your brain. Studies suggest that it may benefit people with neurodegenerative diseases. It may also help to prevent some of the side effects of nootropics, such as paracetam, so it's often taken with them, as well as a choline source to further help support the brain. You can check out my videos on nootropics and on choline sources for more information. Other forms are propionyl L-carnitine. This form is well studied for circulatory issues, such as peripheral vascular disease and high blood pressure. It may boost the production of nitric oxide, which improves blood flow. And then L-carnitine L-tartrate is most commonly added to sports supplements due to its rapid absorption, and it may aid in muscle soreness and recovery from exercise. For most people, acetyl L-carnitine and L-carnitine seem to be the most effective for general use. L-carnitine's main role in your body involves mitochondrial function and energy production. In cells, it helps to transport fatty acids into the mitochondria, where they'll be burned for energy. About 98% of your L-carnitine stores are contained in your muscles, along with trace amounts in your liver and your blood. L-carnitine may help to increase mitochondrial function, which plays a key role in disease and healthy aging. New research illustrates the potential benefits of carnitine's different forms, which may be used for various conditions, including heart and brain disease. In theory, using L-carnitine as a weight loss supplement makes sense, since L-carnitine helps move more fatty acids into your cells to be burned for energy. You might think this will increase your ability to burn fat and lose weight. However, the human body is extremely complex, and the result of both human and animal studies are mixed. In an 8-week study in 38 women who exercised 4 times per week, there was no difference in weight loss between those who took L-carnitine and those who didn't. Another human study monitored L-carnitine's effect on fat burning during 90-minute stationary bicycle workout. 4 weeks of taking the supplement did not increase fat burning. However, one analysis of 9 studies, mostly in obese individuals or older adults, found that people lost on average 2.9 pounds more weight when they were taking L-carnitine. While it may aid in weight loss for obese individuals or older adults, a thorough diet and exercise regime must also be in place first. L-carnitine may benefit brain function. Some animal studies suggest that the acetyl form, acetyl L-carnitine, may help to prevent age-related mental decline and improve markers of learning. Human studies indicate that taking acetyl L-carnitine daily helps to reverse the decline in brain function that's associated with Alzheimer's and other brain diseases. This form exhibited similar benefits for general brain function in older adults who did not have Alzheimer's or other brain conditions. In specific cases, this form may even protect the brain from cell damage. In a 90-day study, people with alcohol addictions who took 2 grams of acetyl L-carnitine per day experienced significant improvements in all measures of brain function. Some studies demonstrate a potential for reducing blood pressure and the inflammatory processes associated with heart disease. In one study, 2 grams of acetyl L-carnitine per day resulted in almost 10-point drop in systolic blood pressure, the top number of the blood pressure reading and an important indicator of heart health and disease risk. L-carnitine is also linked to improvements in patients with severe heart disorders, such as coronary heart disease and chronic heart failure. One 12-month study observed a reduction in heart failure and deaths among participants who took L-carnitine supplements. Evidence is mixed when it comes to L-carnitine's effect on sports performance. However, several studies note mild benefits associated with larger or more long-term doses. L-carnitine's benefits may be indirect and take weeks or months to appear. This differs from supplements like caffeine or creatine, which can directly enhance sports performance almost immediately. L-carnitine may improve exercise recovery, increase oxygen supply to your muscles, improve stamina. It may increase the blood flow and the nitric oxide production, helping delay discomfort and reduce fatigue. It may reduce muscle soreness after exercise, and it may increase the production of red blood cells, which transport oxygen through your body and your muscles. L-carnitine may also reduce the symptoms of type 2 diabetes and its associated risk factors. One study of people with type 2 diabetes taking anti-diabetic medication indicated that carnitine supplements significantly reduce blood sugar levels when compared to a placebo. It may also combat diabetes by increasing a key enzyme called AMPK, which improves your body's ability to use carbohydrates. For most people, 2 grams or less per day is relatively safe and free from any serious side effects. One study where people took 3 grams per day for 21 days experienced no negative effects. In one review of L-carnitine's safety, doses of approximately 2 grams per day appeared to be safe for long-term use. However, there were some mild side effects, which included nausea and stomach discomfort.